How many times did you get up last night to use the bathroom? Once? Twice? Maybe 3 or 4 times? If you're nodding your head right now, you're definitely not alone. Frequent urination at night is one of the most common complaints I hear from people over 60. This condition called nocturia isn't just annoying, it's stealing your sleep and making you feel exhausted the next day. Here's the good news. Science has discovered some fascinating reasons why this happens, and more importantly, what you can do about it. Today, I'm sharing 8 proven strategies that can help you sleep through the night without constant trips to the bathroom. Before we dive in, let me be clear. It's actually normal to wake up once, maybe twice per night to urinate as we age. But if you're getting up 3, 4, or even 5 times, that's when we need to make some changes. So let's get into it. Tip number 1. Work with your body's internal clock. Here's something most people don't know. Your kidneys have a built-in timer. Research on circadian rhythms shows that your kidneys work completely differently depending on what time of day it is. For the first 10 hours after you wake up, your kidneys are filtering fluids at maximum speed. They're pulling water from your bloodstream, removing waste, and producing urine rapidly. This is actually what you want during the day. Your body is designed to process fluids efficiently while you're awake and active. But here's where it gets interesting. Around 10 hours after you wake up, your kidneys dramatically slow down. This isn't a malfunction. It's intentional. Your body knows you need to sleep, so it reduces kidney activity to help you stay asleep longer. The problem happens when we fight against this natural rhythm. If you drink large amounts of fluid after that 10-hour mark, you're essentially asking your kidneys to work overtime when they're programmed to rest. It's like asking someone to do heavy work at the end of their shift. They can do it, but not efficiently. So here's what you should do. Calculate when your 10-hour mark is. If you wake up at 7 a.m., your kidneys start slowing down around 5 p.m. From that point until bedtime, limit yourself to just 5 to 8 ounces of fluid. That's about half a regular glass of water. And here's the critical part. Don't gulp your evening fluids. Your body has sensors in your gut that detect how fast liquid enters your system. When you gulp down water quickly, these sensors trigger faster filtration, which means you'll need to urinate sooner. Instead, sip slowly. This small change can make a significant difference in how long you can sleep before needing the bathroom. Tip number 2. Stop training your bladder to fail you. Let me ask you something. Do you go to the bathroom just in case before leaving the house? Before going to bed? Before a car ride? If you answered yes, you might be making your nighttime problem worse. I know this sounds backward. You're thinking, of course I go just in case. I don't want to get stuck needing a bathroom. But here's what actually happens when you make this a habit. Your bladder is designed to hold about 16 ounces of urine comfortably. When it reaches that point, it sends signals to your brain saying, time to find a bathroom. But when you constantly empty your bladder before it's truly full, when it's only holding 4 or 6 ounces, you're teaching it to panic early. Over time, your bladder starts sending urgent signals when it's barely half full. It's like a car alarm that goes off when someone just walks near the car instead of actually trying to break in. You develop an urgency to urinate constantly, even when there's barely anything there. I've seen people who are going to the bathroom 8, 12, even 15 times per day because of this habit. They'd go 5 times in the last hour before bed, trying desperately to empty everything out. But all they were doing was making their bladder more sensitive and reactive. Breaking this habit isn't easy, and I'll be honest with you, the first few nights are uncomfortable. But here's a strategy that works. Go to the bathroom 1 hour before your bedtime. Then go once more about 15 minutes before bed. After that, commit to staying in bed even if you feel the urge. The feeling will be strong at first, but it will pass. Do your deep breathing. Do some light pelvic floor exercises, which we'll talk about next. Give yourself 1 full month of this routine. Most people find that after 3 to 4 weeks, those urgent false alarms decrease dramatically, and they can finally sleep longer stretches. Tip number 3. the 5-minute bedtime exercise that changes everything. This next strategy might sound too simple to work, but clinical studies have proven it can reduce nighttime bathroom trips by more than 1 full visit per night. All it takes is 5 minutes before you fall asleep. I'm talking about pelvic floor exercises, often called Kegels, though that's not the complete picture. These exercises do more than just strengthen muscles. When you do them correctly right before sleep, they activate your entire pelvic support system, help slightly lift your bladder, and most importantly, they reset the connection between your brain and bladder. Here's how to do them. Lie on your back in bed. You can even do this while reading or watching TV. Tighten the muscles you'd use to stop urinating midstream. Pull up and in. Hold for 5 seconds, then release completely for 5 seconds. That's 1 repetition. Do 10 of these, rest for a minute, then repeat 2 more sets. The beauty of doing these at bedtime is twofold. First, you're ending your day by strengthening the very muscles that help control urination. Second, this practice teaches you something called urge suppression. Urge suppression is a game changer. When you feel that urgency to urinate in the middle of the night, here's how to control urination at night naturally. Instead of immediately getting up, do 3 to 5 very quick, strong Kegel contractions. Hold each for just 1 to 2 seconds, then release. What happens next is remarkable. That overwhelming urge, the one that feels like it's screaming at you to get to the bathroom now, it will fade. It gets very intense, peaks, and then it goes away. This isn't magic. It's your pelvic floor muscles communicating with your bladder, telling it to calm down and wait. Research shows that people who practice this technique consistently for 3 months reduce their nighttime trips by an average of 1 full bathroom visit. For some people, that's the difference between waking up twice versus 3 times. And more importantly, it improves overall sleep quality dramatically, which affects how you feel all day long. Tip number 4, the 2-hour fluid cutoff rule. This one might seem obvious, but let me explain why the timing matters more than you think. Your bladder fills at different rates depending on several factors, and one of the biggest is simply how much you're drinking and when. If you're sipping tea or water right up until you turn off the lights, your bladder will reach capacity quickly, often within 2 to 3 hours. One of the best ways to prevent frequent urination at night is to stop fluids 2 hours before bedtime. But I want you to understand the science behind this, so you can adjust it for your own body. When you drink fluid, it doesn't immediately turn into urine. It takes time for your body to process it through your digestive system, filter it through your kidneys, and deliver it to your bladder. This process typically takes 90 minutes to 2 hours. So if you drink a full glass of water at 9 p.m. and go to bed at 10 p.m., that water will hit your bladder right around midnight, exactly when you want to be in deep sleep. Now, if you need to take nighttime medications, don't skip them. Just take them with 1 small sip of water. About an ounce, not a full glass. That's enough to swallow pills without adding significant fluid volume. Also pay attention to what you're drinking. Bladder irritants like caffeine and alcohol don't just add fluid. They actively stimulate your bladder and increase urgency. That evening coffee or nightcap might seem relaxing, but it's working against you. Try to avoid these completely after 2 p.m. if nighttime urination is a serious problem for you. Make sure you're drinking enough during the day so you're not desperately thirsty at night. Tip number 5, the double empty technique. Here's a simple trick that urologists recommend, especially if you have any issues with incomplete bladder emptying. We call it double voiding, and it works like this. When you go to the bathroom before bed, empty your bladder completely, or what you think is completely. Then, stand up, walk around your bathroom for about 30 seconds, maybe do a few gentle twists or bends, then sit back down and try to urinate again. You might be surprised to find that more comes out. Why does this work? As we age, our bladder muscles don't always contract as efficiently as they used to. Sometimes urine gets trapped in certain pockets of the bladder, especially if you have any prolapse issues or if your bladder has dropped slightly from its normal position. When you stand up and move around, gravity helps redistribute that trapped urine. The movement also relaxes any tension you might have been holding. When you sit back down, you often find you can release that extra bit. This technique is particularly helpful if you notice that you urinate, then feel like you need to go again just 20 to 30 minutes later. That's usually a sign of incomplete emptying. The key is to be patient with yourself. Don't strain or push. That can actually make things worse. Just relax, wait a moment, and see what happens. Even if you only get a small amount out the second time, that's less fluid that will wake you up an hour or two into your sleep. Do this every single night as part of your bedtime routine. Tip number 6. Eliminate evening bladder irritants. Your bladder is surprisingly sensitive to certain foods and drinks, and what you consume in the evening can dramatically affect how often you wake up at night. The two biggest causes are caffeine and alcohol, but they cause problems in different ways. Caffeine is one of the leading causes of frequent urination at night because it directly stimulates urgency to urinate. It makes the muscle wall of your bladder more active and twitchy, which increases those urgent feelings even when your bladder isn't actually full. If you're drinking coffee, black tea, or even green tea in the evening, you're essentially irritating your bladder right before asking it to stay calm all night. For many people, cutting out caffeine after 2 p.m. makes a noticeable difference. Alcohol is tricky because it seems like it would help you sleep, but it actually works against you in 2 ways. First, it's a diuretic, meaning it tells your kidneys to produce more urine than normal. Second, it also irritates the bladder lining, creating more urgency. That glass of wine with dinner or evening beer might relax you initially, but it's setting you up for multiple bathroom trips later. Other common bladder irritants include acidic foods like tomatoes and citrus, artificial sweeteners, and spicy foods. These don't affect everyone equally, so pay attention to your own patterns. Here's what I recommend. For 1 week, eliminate all caffeine and alcohol after noon. Keep everything else in your routine the same. Track how many times you wake up each night. Most people see improvement within 3 to 4 days. If you do, you've found a major trigger. You can then decide if that evening coffee is worth the sleep disruption. Tip number 7. Manage medical factors that increase nighttime urination. Certain medical conditions and medications can significantly impact how often you need to urinate at night, and many people don't realize there are simple adjustments that can help. If you take a diuretic, often called a water pill, for blood pressure or heart failure, the timing of when you take it matters enormously. Many people take their diuretic first thing in the morning, thinking that's best. But here's what happens. You urinate frequently all morning, then your body starts retaining fluid again in the afternoon and evening. By nighttime, you've accumulated fluid in your legs and lower body, and when you lie down, gravity redistributes that fluid into your bloodstream, which your kidneys then filter out while you're trying to sleep. Talk to your doctor about taking your diuretic in the early afternoon instead, around 2 or 3 p.m. This timing allows you to eliminate excess fluid before evening, reducing the amount of fluid your body processes overnight. Never change your medication timing without medical approval, but this conversation is worth having. If you have diabetes, managing your blood sugar is crucial. High blood sugar levels cause excess glucose to spill into your urine, and glucose pulls water with it, leading to increased urine production and more urgency. Keeping your evening blood sugar in your target range can reduce both the volume and the urgency of nighttime urination. Salt intake also plays a role, especially if you have any swelling in your legs or feet. Excess salt causes fluid retention throughout the day, and just like with diuretics, that fluid gets mobilized when you lie down at night. Try reducing your sodium intake at dinner and avoid salty snacks in the evening. This simple change can reduce the total volume of urine your body produces overnight. Tip number 8. Use compression and elevation to redistribute fluids. This final tip addresses a specific problem that many older adults experience: fluid accumulation in the legs during the day that turns into nighttime urine. Here's what's happening. As we age, the small valves in our leg veins don't work as efficiently. Throughout the day, especially if you're sitting or standing a lot, fluid slowly leaks out of your blood vessels and accumulates in your lower legs and feet. You might notice your ankles are more swollen in the evening than they were in the morning. When you finally lie down to sleep, gravity no longer keeps that fluid in your legs. It redistributes back into your bloodstream. Your kidneys filter it, and it ends up in your bladder, right when you're trying to sleep. You can prevent this with two simple strategies. First, try wearing compression stockings during the day. These don't have to be medical grade unless your doctor recommends it. Even light compression socks help prevent fluid from pooling in your legs in the first place. Less pooling during the day means less fluid redistribution at night. Second, elevate your legs for 10 to 15 minutes in the evening, at least an hour or two before bedtime. Lie on your couch and prop your legs up on pillows so they're above heart level. This gives that accumulated fluid a chance to redistribute and be filtered out before you go to bed, not during the night. You can combine this with your pelvic floor exercises. Lie on your bed with your legs elevated on pillows. Do your 5 minutes of exercises, then go about your evening routine. By the time you're ready for sleep, you've already processed that excess fluid. Remember, it's normal to wake up once per night as we age. But if you're getting up 3, 4, or 5 times, these strategies can help. Give yourself a full month to see real changes. Your bladder needs time to retrain. Sleep is essential for your health, energy, and quality of life. You deserve to wake up feeling rested, not exhausted from a night of bathroom trips. Try these tips and see what works for your body. Thanks for watching, and sleep well tonight.